taking some time. Thank you so much for having me. Appreciate you taking the time this afternoon to come here about, excuse me, Health Advocate, the Advocacy and EAP program. As Ria said, we're going to save questions for the end, and please put your questions in chat. It's hard for me to do the presentation and see them at the same time, so I want to make sure I address any questions. And the last thing is, before I get started, if it's okay with everyone else, I'm going to turn off my camera because I tend to talk with my hands, and when I start moving, it distracts me. So I'm going to turn off my camera so I can focus on my screen and not my hands moving around. But I am certainly here. So let's get started. So I want to talk to you about Health Advocate. So Health Advocate, we are an advocacy company, and we are here to provide your school district with hands-on support for a variety of health and well-being issues. This service is available to you 24/7. It is unlimited access for you and your eligible family members, and we'll talk about who they are. We do have an interactive mobile app and website. We have recently upgraded, or I should say enhanced. We've done some enhancements to our website, and I really encourage you to go out there and take a look at them. It's a really nice user-friendly experience, lots of information. And this is a service that is provided to you by your employer at no cost to you. So we like free, right? It's our favorite word, free. So all you need to do is just pick up the phone, give us a call, any questions, any issues, let us know, and we'll work through it with you. So there are some important things that I want you to know about this service. Again, because we're not just providing you with employee assistance, which is your mental health benefit, we also do advocacy, and I'll tell you more about that. But what you need to know is that Health Advocate does not replace your health insurance, and Health Advocate does not provide medical care or recommendations. So we do work with you in terms of, any diagnosis information that you want to talk to us about. And we're not going to recommend treatment. If anything, we're going to give you all of the information that you need to make a well-informed decision. This is a private and confidential service. So I manage this account. I do not share any personal health information. I do not say Ashley called. I don't say Ria just called. That is going against HIPAA violations. So just like as your doctor, when you go to the doctor's office, you have to sign those HIPAA forms and protected health information, which is PHI. We do the same thing. So I don't provide that information. So that's really important that I want you to know that. So we do protect your privacy. All of your health information is kept strictly confidential. And like I said, we follow those HIPAA guidelines. So who are the people that you're talking to? You want to know, who am I calling? When these people pick up the phone, we are providing that personalized support and guidance to you. So our team is made up of several different folks, such as our medical directors and our nurses, our RNs. All of our RNs who are involved in our clinical cases, they are supported by our medical directors. Just so you know, they are getting that clinical supervision or clinical, consultation with our medical directors. We have case managers and social workers. We also have behavioral health specialists, because we do have licensed professional counselors. We have people who are marriage and family counselors. So there's other modalities for different, behavioral health specialists. We also have benefits experts and claims experts. So when we talk a little bit more about the advocacy side of the business, that's where you're going to be working with a claims specialist when it comes to any of your medical issues, or a claim that you want monitored or audited. You'd be working with those folks. And then we do provide coverage and appeals experts. So if you go into the hospital and you need to appeal a bill, we can get you set up with an appeals expert. And then we have research associates. So those are the people who are doing all the research behind the scenes, finding you the right doctors, hospitals, specialists, and so forth. So there are a variety of ways in which you can connect with us: phone, through our mobile app, the website, email, and chat. So this service is provided to the whole family, and this is a really nice benefit to our services, where we provide an extension of your family. And when I say extension, I'm meaning like your parents and your parents-in-laws. What other benefits are you getting where they will work with your parents and your parents-in-laws directly? If they have issues with, Medicare, they want to know what Medicare plan should I choose? I need to change my plan, those kinds of things, because Medicare is a very complex system as well. And we can help, your spouse. And this is also, I want to point out, if your spouse, for whatever reason, if you are on the plan, through the district, and your spouse works somewhere else, and it just made sense for your particular situation, for your spouse to have the plan at their work and you to have a plan at your work, it doesn't matter. They don't have to be on your plan. We will still work with them and provide them the benefit. So you see employee, spouse, domestic partner, dependents. It's the dependents that are on your plan to age 26. So let's talk about the EAP services first. So May is Mental Health Month, so we definitely want to talk about our mental health, right? We want to all take care of our mental health and make sure that we are addressing whatever issues need to be addressed. And we are here for you 24/7 to help with those personal and work-related issues. So several different ways in which our program operates. So again, it's the Employee Assistance Program. So I'll keep saying EAP because that's what it stands for. There's also that work-life support, because we all need support to balance. We're trying to balance it all, right? We're trying to manage our home life, our work life, and our, other things that we do within our lives, whether it's taking care of our parents, if you have small children and you're taking care of your parents. So you're in the middle and you're trying to figure it all out. So it's a balancing act. And then you've got financial wellness, and then you've got management assistance. So the financial piece is, again, anything related to like your finances. And then management assistance is anybody who is in a manager position, manager or supervisory position. We provide that support as well. So when I talk about confidential help with personal issues, those are issues such as, relationships. Obviously, we all have relationships, right? So whether it be our personal relationships, our work relationships, sometimes there's work conflicts, right? You have conflicts with your coworkers. So it could be, your work relationship, family and parenting issues, depression and anxiety, substance abuse, stress management, grief and loss, life transitions, all of these issues. And there are so much more. I can only get so many on the screen. So please believe that there are, certainly other things that we can address with you. And you will get up to 4 free sessions per issue per year. So I did put a little bit of action in here so you can see what I'm referring to. So here is that help regarding like a personal issue in action. So Jane was prescribed a number of medications to treat depression and mood issues. And whenever stress mounted, however, she started reaching for more pills, which was beginning to affect her performance at work. So Jane reached out to Health Advocate, and her EAP professional helped her to sort through her prescriptions, suggest ways to follow recommended regimen, and more closely monitor her use, offered techniques to help Jane better manage her stress, and connected her with resources specializing in substance abuse. So that's one example of how our EAP professionals can assist a member with personal issues. when we talk about, balancing work and life. So we have work-life specialists. So that's what they do. They focus on helping you to balance it all, and looking at those local services and resources that are there to help you. Balancing work and family, as we've been talking about, elder care, child care. So if you have children, like here's a perfect example. I mean, it's May is here already. So you guys are in Columbus, I'm in Pennsylvania. Our kids, well, my son he's a junior in high school, but the kids get out in June. But parents who are looking for childcare or summer camp, definitely take a look at our website or reach out to us, because we can help identify summer camps that may be available in your area, in the Columbus area, or wherever you live. We do the research. So our work-life specialists, I mentioned earlier, we have research folks. They can do that research for you and identify what summer camps are in the area. Same thing with elder care. If you are caring for your parents, or maybe your parent, maybe he was in the hospital and they're being discharged from the hospital, and maybe they need some adult daycare, just to get them out of the house and get them involved, get them around other people. We can do the research in identifying elder care services in the community, and maybe get them into some type of program that'll get them a little more active or just not isolating. And then you've got occupational stress. I commend everyone who works in the school district, and it is not an easy job. My sister is a teacher for 25 years. And like I said, I have a junior in high school. So occupational stress is real, right? And then there's time management. Again, I'm trying to balance it all. It can be a juggle. So helping you to balance work life. So here's an example of that. So Dana's mother's heart attack and other health issues had worsened, and as her primary caregiver, Dana was experiencing overwhelming stress and exhaustion. So she called Health Advocate. Her EAP professional and work-life specialist then researched and located a local healthcare provider covered by Medicare and her mother's supplemental plan to help her with day-to-day caregiving duties. So the EAP specialist coached Dana on the importance of self-care and scheduled a series of counseling sessions to help her cope, because then Dana needed some support herself. So let's look at some of those financial issues I mentioned. Here is where you have the opportunity to have a free consultation with a financial specialist. They are available online and by phone. So this is a consultation, if you're looking at your debt and you're saying, you know what, I have got to get my finances in order. I want to talk to somebody about debt counseling. They can help you to identify what's the best way or how to start that process. Sometimes it's overwhelming, and unfortunately, if people live paycheck to paycheck, they think, how can I ever get out of debt? How can I ever pay off these bills if I'm, living paycheck to paycheck? But that's what your debt counselor can help you with, helping you to restore your credit, budgeting. People oftentimes always try to figure out how to save money, but they don't start with their day-to-day activity. Starbucks can put a little dent in your pocket. So you got to figure out how to budget correctly, identifying theft, home refinancing, student loans, and retirement planning and divorce. So these are all important topics that affect our finances. So here's an example of a financial issue. So Robert was laid off after 15 years on the job, caught off guard. His reaction of anger and anxiety, coupled with the loss of income and uncertainty for the future, was causing friction in his marriage. So he's got a lot going on in this situation. So Robert called Health Advocate. The EAP professional set up couples counseling and discussed strategies to help Robert and his wife cope with the layoff and communicate more effectively about money. They set up individual counseling for Robert to work on his anger, and he could effectively begin searching for a new job so that he could search for a new job, and then connected him with a financial specialist for free consultation. So there's a lot going on in this example, but there's so many different things in which we can help Robert, as you can see how our EAP specialist helped him with the financial aspect, the marital aspect, as well as now it's time to, start looking for a new job. So now we turn to legal issues. So again, you will get a free consultation. This is a 30-minute consultation with an attorney. And the additional piece is that if you choose to then continue on with that attorney, you will get 25% discount on their fees if you retain them. So I don't know if you've ever worked with an attorney, but there are attorneys who make $300 to $500 an hour. So if you can save 25%, this is a good place to start. We talk about criminal law, there's general law. So through that consultation, you can talk to them about whether or not, like, here's my scenario. Do I have a case? Through that consultation, because you're not sure whether or not you have a case, and should you pursue it, or does it make sense, or do I have enough information? But that's what that consultation is for, to help you make that decision. Here's an example of a legal issue in action. Joanne was going through a difficult divorce. With no family nearby and no idea how to find a lawyer, her stress and depression were getting worse by the day, impacting her job. So Joanne called Health Advocate. The EAP professional assessed her symptoms and provided short-term counseling and stress management techniques, referred her to a specialist for additional support for her depression, and then connected her with an attorney for a complimentary consultation. Because she's going to need to have that conversation about, where do I begin? How do I even start this process? So we're here when you need us most. We can provide that in-the-moment telephonic support. So when I say in-the-moment support, just know that, like, say you're having a difficult day and maybe you just had a disagreement with a coworker, or maybe you had a disagreement with your boss, and you're feeling flustered and just frustrated and, just sort of chomping at the bits. What am I going to do? And you need somebody to vent to. You may not feel like you want to vent to your coworkers because you're just not sure who's going to tell who and who's going to whatever. You can give us a call and have an in-the-moment support and help you deal with that situation in that moment to help you cool off, help you calm down, help you deal with that stressor, and maybe give you some tips on what to do the next time it happens, or just how to manage it moving forward. You can have virtual telehealth. So we do offer face-to-face sessions. So again, you have up to 4 sessions, but if you choose not to do them face-to-face, you do have the option of doing them virtually. I will tell you that the EAP professional will do an assessment to make sure that that's appropriate and that it makes sense for you and your situation. These are master's level clinicians. All of our clinicians that are picking up the phone all have a master's degree, and we do have some who have advanced degrees as well, but the base is a master's level. These are behavioral health specialists. So again, social workers, people who are licensed social workers. I myself am a licensed social worker. We have licensed professional counselors, marriage and family therapists, and so forth. We provide, I did mention the manager assistance. So again, if you are in a manager role, we provide additional services that are specific, I should say, to managers, like performance evaluations, things like that. And I mentioned some of those other things earlier. And it's a 24-hour support, providing you with 24/7, 365 support. And also, just so you know, we can communicate with folks in over 200 languages. So please don't let that stop you. Or if your parents are speaking of a different language, or if English is not their first language, we can connect with folks in over 200 languages. So that was the EAP program. So now I'm going to talk a little bit about the advocacy program. This is our health advocacy. This is at the heart of everything we do. That is our core service. Our company started in 2001, and we started as a core advocacy, an advocacy company, being a healthcare advocate for members. So these are experts to help with healthcare and insurance-related issues. So your personal health advocate can help in the following ways. They can help with coordinating care with your providers. So, you go to your primary care doctor, and then you may need to follow up with the specialist, and then you go back to this doctor. Whatever the case may be, back and forth between your doctors, they can coordinate all of that care with your providers. They can provide support for medical conditions, such as, if you are diagnosed with something, you've been given this diagnosis. Sometimes, we leave the doctor's office and we say, gosh, I wish I had asked this question. Because, you walk away, and after you've had some time to sort of process what they just told you, you're like, okay, what's my next move? And you forgot to ask these questions. You can always reach out to Health Advocate. We have nurses on staff who then will answer your questions about a diagnosis, talk through that medical condition. We can give you all of the information, on the evidence-based treatment. If there's clinical trials out there that they're running for people with particular diagnoses, or you're given a diagnosis of you need to have surgery, and not everybody wants to have surgery. You want to sometimes find out what are the alternatives. I want to know if there's holistic medicine. Some people want to do treatment from a holistic perspective. You can do that as well. Give us a call and say, can I, understand some alternative treatments? We can help you find the right doctors and the right services. So when we talk about finding doctors, Health Advocate goes an extra step. And what that means is you can certainly go on to whatever your medical carrier's website is and look for a doctor. We all can do that, right? And we can do that for you too. But what we're going to do is our advocates are actually going to reach out to these doctors, and we are going to confirm that they are board certified in what they say they are licensed to do. So if a doctor says that they have they specialize, their specialty is OBGYN services, you want to make sure that they're not just the primary care doctor, that they really do have that certification in OBGYN studies. So we're confirming they're board certified. We're also confirming that there are no litigation, malpractice issues. We're confirming that they are, in fact, accepting new patients. I can tell you, I was recently doing this, looking on my website for a doctor, and they say accepting new patients, and I'm calling and saying, can I schedule an appointment? And they said, we're not taking new patients. And that's because the websites aren't often updated, immediately. It gets put into the system, but it may need to run through a process. So they may not be updated quickly, when you're calling, but that's the beauty of our service, is that we do all that leg work for you, because it is time consuming. So you're at work, you guys are busy, you're doing what you need to do. You don't necessarily have time to be on the phones, making phone calls, being transferred around, or hitting a bunch of prompts to get to the right department. So we'll do all that for you. We'll research and arrange a second opinion. So like, as I was talking, the example I was speaking of, when I talk about like second opinion, or the example of, being told that you need to have surgery, you can also say, I want a second opinion. You can give us a call, and we will sort of help get that process going to arrange that second opinion, because you want to find out, do I really need to have surgery? Are there alternatives? Or I'm not sure this diagnosis, I'm not sure about this diagnosis, and I want to get a second opinion. We can do all of that. We help with the paperwork issues like billing claims and stuff. That's overwhelming in and of itself, billing claims. When you get all that stuff in the mail and trying to read through it and making sure that you understand it, it is very overwhelming, very confusing. We will actually audit those claims for you. We will look at those bills. We can make sure that they are correct. Just to give you my own personal experience, when I started Health Advocates 7 years ago this year, my first experience, I was 6 months into the job and I had no personal experience with Health Advocates services. So I thought, you know what, I need to have some experience. Perfect timing because I took my son to the allergist. He has allergies, really bad allergies, food allergies and asthma. And we were scheduled to do a breath test. This is a breath test. It's $450 for this breath test. He literally breathes 3 times and it's over. Well, I was charged $450 for the test plus the other services. Well, that particular year, we didn't do the breath test. It was scheduled, but when I spoke to the doctor and we agreed that it was okay that he didn't need the test, they never took it off the paperwork. So it still got processed. So when I received my bill, it was $850. And I thought, no, we didn't do this test. Perfect timing. I sent it to an advocate. I did it on the computer. You can go onto the website and then click file a claim. And I did that. And then my Catherine was an advocate that was assigned to me, and she took off with the whole process. It took about 4 weeks, but that would have been 4 weeks of me on the phone, back and forth, making phone calls, following up. But I was in a new job. I was 6 months into my job, and there's a lot when you're trying to learn a new job. So I was glad that I had that advocate and I had that experience, because now I can share with you my personal experience of what a weight lifted off my shoulders to have somebody else do that for me so that I can focus on my job. That's just my personal experience. And I encourage you that if you have that experience where you're overwhelmed with that bill or claim, you want information, give an advocate a call. So we can also provide special help for parents and parents-in-laws, and I did mention that. Well, one of the other things, what I should have put on here is also special needs. So we also provide services. We can assist with special needs children who, if your child is diagnosed with, autism or Asperger's, we can do research. We can find services for your child or any of your dependent. Doesn't have to be a small child, but your dependent. So that's one of the things that we often get asked for is, we need help in looking for programs for children with special needs. So we can do that as well. One of the things I mentioned to you earlier is I really encourage you to go out to the website. Our website has been enhanced. There's so much information out there. I can't even tell you. There's a really nice blog. You type in anything you'd like in terms of, when you're searching for information. We have all kinds of health information. It can also be related to wellness. I know you guys have a very robust wellness program that I think is absolutely fabulous. I've sat through a couple of the presentations for your wellness. But we have lots of information, relationship topics. There's recipes if you're looking for a new recipe or something different. But just check out what the advocacy program has to offer you, just to get a feel for all of the services that are available to you. Again, I know it can be overwhelming, but do it in a moment where you're not in need, because what happens is when something happens, that's when you're in a panic and you can't find anything. I know we have EAP, but I don't even know where to go. I don't even know where to look. Where do I start? But if you do it in a moment, like today when we're done, just take a peek and look at it. Now you have an idea of where it is. So in that moment, when you're in a desperate need, you know where to find the information. So some of those resources, the website obviously is available to you 24/7, access to articles, tips. There's lots of videos. We have videos, we have there's also what do I want to call them? Webinars. There's webinars. So, excuse me, mental health webinars, just taking care of your health, your well-being. There's interactive courses on leadership and personal growth. Very, very easy for you to reach out to one of our advocates if you need some direction. You can get details about the program features. You can search and read those articles on emotional well-being. Like I said, there's financial things, relationships, legal, everything. Sign up for monthly webinars. We do send this information out. I hope that you see it, or you'll see it on your website where all your information is posted. But we do host webinars. And I'm sorry, it's escaping me what our webinar is this month, but it's on May 18th. You can mark that on your calendar. I know it's at March 18th. I'm sorry, May 18th. And we run them twice a day, and they are recorded. So you can also still look on the website and click on webinars, and you'll see a whole host of webinars that we've done in the past. They're recorded. And then there's resources for financial fitness and personalized legal centers, mindfulness web pages, and you can also take some assessments. There's assessments there for like mental health. Some folks are, am I depressed? Asking like, am I truly depressed? There's an assessment for depression. There's one for substance abuse. Some people don't necessarily identify, having 2 shots of vodka every single day as a problem. Well, that might be something you want to have assessed. It could be a problem, or it could become a problem. So you want to, maybe do an assessment and have a conversation with someone about that. So here's the ways in which you can reach Health Advocate. So you can reach out to us via phone, again, 24/7. If you have questions, you can use this email. Please don't use this email for emergencies, because that's not what it's for. It's just if you have a general question, and it's something that can wait 24 to 48 hours. That's what that email is for. We also have a chat function, and I should have added that. I apologize. You can chat too. So if you have questions and you want to do a chat, you have the ability to do that as well. Our hours of operation, we are physically, well, we're not in the office anymore. Most of us are still virtual. So if we were in the office, we're physically Monday to Friday from 8 to 10. However, we do have folks that work after hours. So there are still people picking up the phone after 10 o'clock. It's just what we call work hours. Like some people say 9 to 5. We are a 8 to 10 operation. And then we do pick up the phone after hours and weekends. Okay. So that concludes what I wanted to share with you about the Advocacy and Employee Assistance Program. I think everyone may be familiar with Samitha and Jacqueline. Those are two of my day-to-day contacts. I know they provide your district with a wealth of information around wellness. So wellness and the advocacy and the EAP, I think all of that information is housed in a particular area. So if there are any questions, I'm happy to answer them.
Thank you so much, Jane. As she stated, if you have questions, you can put them in the chat or feel free to unmute yourselves. At this time, we'd love to hear from you.
Perhaps when we were talking earlier, you've had the opportunity to maybe go to the website. Because again, I highly encourage you to go out to the website and take a look at it, click around, see what you see. One of the things that I wanted to mention, I think, and I may have already mentioned, you can write on the website, right on your phone. How about that? Download it to your phone, because oftentimes we're walking in the front door with what? our mail in our phone in our hand.
Mhm.
You're going to open up that mail and you're going to see that bill from whatever your carrier is or your doctor's office and say, what? They billed me for my hospital stay? And you can pull out your phone. If you've got the Health Advocate app right there on your phone, you can take a picture of that claim and immediately shoot it off to Health Advocate.
Mhm.
How quick is that? Just
Yeah.
shoot it. You have to put your name, you have to fill out your name, and then we do ask you what's the best way to communicate with you, whether it be you would put your phone number in there to communicate with you via phone or your email address, and then we communicate with you that way. I just think that that's a really quick and easy way to get an issue addressed right away, because you're going to put that mail down and you're going to walk away and you're going to forget about it. And then next week you're going to be, oh, you know what? I still need to do this. I'll get to it. I'll get to it. And I'm speaking from personal experience. I'm
Yeah.
sorry.
Same. No, you're
Listen,
not alone in that.
everything I say is personal experience here.
No, you're not alone in that. That's a very real scenario where you get the bill and you're like, what is this about? What does this mean? And you don't know where to start. So that is a good option to be able to just pull out your phone and get that handled almost immediately.
Exactly. So yeah, so please do take the time to download the mobile app, Health Advocate. You will need to register. And again, your information is not shared. I do not provide Columbus City Schools, anyone's name, anything like that. You would put in your name, the way your name is in HR. So like if your name is Catherine, but you go by Katie or Kate, you need to put in Catherine. So it's your legal name and how it's spelled through HR. You put that information in there, your date of birth and your zip code. And that is how we register you. You do have the option though, to go in and use the EAP services anonymously.
Okay.
If that's what makes you comfortable, you go down to the bottom of the screen and click on anonymous. You can do that as well.
That's perfect. I was going to actually ask that about those particular services. We had a comment also in the chat from Ms. Smith, who said she's used the service previously for her son and it was a lifesaver. Just one that she didn't realize the amount of services that were available. So thank you, Ms. Smith, for sharing that.
Yes, thank you. I appreciate that.
And as Ms. Jane Morales stated previously, there's the information here on the screen. There's the Health Advocate app, but additionally, you can find this information on the CCS webpage. So if you do go to ccsoh.us, and on the top banner, you'll see Wellness Initiative. If you click on the Wellness tab, there's also an option to find your Health Advocate more information, how to access those accounts from that way as well. So many different avenues to which you can contact Health Advocate services and ask your questions. So definitely a lot of diversity. If you're a person who's more comfortable on the phone, there's that option. Or if you are more tech savvy and like to use an app, or even get your questions answered through email. So really good options here to be able to take advantage of these services through Health Advocate. And while we have Ms. Jane, while we still have her here, are there any questions? And they don't have to be necessarily personal questions, but questions about any services that you may be curious about, or anything you may have, a challenge you may have faced, whether it's finding a healthcare provider or finding support services for family members and wondering if this is something that Health Advocate can help you with. Please feel free to place those questions or in the chat or unmute yourself to ask. I do know something you did mention, Ms. Morales, it's a summer camp. That's something I was not aware of that you could find, and that's a huge one, especially with summer right around the corner. I know I've got a 6-year-old and I think I'm being early when I try to apply in April, but the wait lists have already formed January. So it's really, it's nice to know that that's also an option, because that there are tons of options to sift through. Camps are expensive, there are long wait lists. So that's
Mhm.
really nice to know. That's something I learned tonight. I did not know
Yeah.
that was an option. So I'll definitely be seeking that out for my little guy, because I am behind the
I was
ball.
gonna say you're behind, right?
I'm behind the ball. Mommies were ready in January, and I
Oh
thought,
my
oh,
gosh.
it's April. I'm pretty early, and I am not. So
Nope, I remember those days. Can you see my screen? I
yes.
changed my screen to, this is our website. So you would come in here just
Oh,
so
this
you,
is the PowerPoint still.
oh,
Mhm.
let's see. Uh, where's it at? Okay, can you see my screen
Yes,
now?
I can see your screen.
And it says enter your organization.
Yes.
Okay, so this is where you would come in and type in, you start typing in Columbus. And these are all of our clients. So you find your school, Columbus City Schools. Now I won't be able to log in because I don't have access to this, but I just wanted to at least show you the website where you come in and put in your user ID, your password, and then down here, if you've never done it before, you need to set up your account. This is where you would register. And that's where I was mentioning your first name, last name, date of birth information, and zip code. The other thing I wanted to show you where I was mentioning is you can browse a subset of the resources that do not require an account. So, but just be aware that if you're going to log in, you want to browse the EAP site, just know that you're going to be limited to the access because you're not registered. So, because this is a service that's paid for by the organization, people have to be, enrolled in the program, honestly. So, but you can still come here and still get to see a lot of the resources. Like if you wanted to take a webinar, visit the webinar, and you want a certificate when you're done, you would have to be registered in order to do that type of thing. But you can still come in here and search around, looking at different information, tabs here, the legal information, all those things that I mentioned throughout. We also, one of the things I didn't mention to you, part of our advocacy service, when we talk about legal forms, we also have, you would have the ability to complete a will, and you can do that for free. So
Wow.
this is just, a small, if you're making $1 million, we can't help you. You want a lawyer for that. But, just a simple will, you can
Wow.
do that for free. Yes.
I did
So
not know
again,
that.
there's so many resources that are available. There's calculators to help you, with financial piece, financial savings. And this is where I mentioned those assessments. You can get insight into risk, what are the risk levels? So here's the health information, here's emotional. So that alcohol, alcohol usage disorder. So it's identifying alcohol, if alcohol is a problem,
Mhm.
depression screening, and drug abuse screening. And there's several others here listed. So this way, I just wanted you to see that this is a way in which you can use the EAP site, just kind of getting information and surfing the web page before you actually, um, register. If you're feeling, a little apprehensive and want to do a little research before you, sign up for it. But again, the service is free. You don't even have to use the website if you don't want to. You just call us and we can still help you with whatever it is that you're looking for.
Thank you for walking us through the website, because I think, like you said, it gives you a chance just to kind of scroll through and see what all the offerings are. If you are apprehensive about creating, making that decision over the phone or through the app, I appreciate you kind of walking us through that. We do have one question in the chat as we kind of wrap up. One question is, can Health Advocate help finding elder care or similar? So just some sort of elder care?
Yeah, so any elder care related to like whether it's assisted living facilities, personal care facilities, if you're looking for somebody to do in-home services, we'll look for the resources that provide the care that you're looking for. You want somebody to come into your home, maybe to help with your parents or your in-laws, do medication checks, maybe even just finding, a Meals on Wheel program, or finding like I mentioned earlier, like adult daycare. You just want to get your mom or dad out of the house, or they're isolating. You want to get them around people that they can, have a conversation, who may have some similar interest or something. We also can help with like any Medicare. So like every year, Medicare has open enrollment. Well, Medicare is very confusing. It's a very complex system, just as our healthcare is. And we can help with understanding the Medicare parts A, B, D. I think there's every letter there, and why those supplemental plans are important. Because not everybody understands that there's the A's and the B's don't cover everything. So you might need those C's and D's. And that's what's confusing about Medicare. So yes, there's a lot of different things that we can do with assisting in elder care. I hope that answered the question, because it was very broad.
It did. She said thank you.
Okay.
Thank you in the chat, and a thumbs up as well. So that was, that was perfect. And thank you, Carrie, for your question as well, because it looks like there were some others who may have had a similar question to you. And thank you, Miss Morales. We're wrapping up. The time goes off. This hour goes so quickly.
It does.
Each time. I never expected to go as quickly as it does. Before we kind of transition into the evaluation portion, does anyone else have any more questions? Before we wrap up, I want to make sure everyone gets their questions answered, or any more information that they would like. And if not, you're more than welcome. I'm a person who I think of it later. So if you do think of a question later that you might have, please feel free to reach out to myself, or Smitha or Jacqueline in the wellness department. They're always very responsive, and we can make sure that we can get that question answered for you all. Someone in the chat says, this is really great. I can't wait to get registered. And that's always really good news. So
Good.
thank you. Thank you. We do want to issue just a huge thank you to Ms. J. Morales for taking the time out this afternoon to give us this information. I'm excited to take advantage of some of these services as well. This is very, very wonderful information and very timely. I know, as you stated, a lot of us are with life and work and trying to find that balance. It can get overwhelming. So this is perfect information at the perfect time. Lots of thank yous flooding in through the chat. So if you get a chance to check those out, please do.